This topical cream kit contains Mometacure 0.1% to 5% corticosteroids, which are used to treat skin conditions like eczema, psoriasis, allergies, and rash. It works by reducing inflammation, itching, and redness. The medication comes in different forms such as cream, ointment, and lotion, and your doctor will prescribe the most suitable one based on the specific skin condition and area of the body being treated. The recommended dosage and timing for application should be strictly followed as prescribed by your healthcare provider. Before using Mometacure 0.1% to 5% topical creams kit corticosteroids, make sure to read the patient information leaflet from your pharmacist. This medication should only be used on certain areas of the skin, such as not on the face, groin, or underarms, and not for diaper rash, unless directed by your doctor. Remember to wash and dry your hands before using the cream, and clean and dry the affected area. Apply a thin film of medication to the affected area once daily, as directed by your doctor, and gently rub it in. Do not cover the treated area with bandages or other dressings unless instructed to do so by your doctor. After applying the cream, do not wash or rinse it off immediately. Wash your hands with soap and water after each use, unless you are using this medication to treat the hands. Avoid getting the medication in your eyes, nose, or mouth. If this occurs, rinse thoroughly with water and call your doctor if irritation lasts. Use this medication regularly at the same time each day to get the most benefit from it. Do not apply large amounts, use it more often, or use it for longer than prescribed. If your condition does not improve after 2 weeks of treatment or if it worsens, be sure to tell your doctor. When using Mometacure topical creams kit, you may experience some temporary burning, itching, or stinging. If these effects persist or worsen, notify your doctor or pharmacist immediately. This medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of side effects. Most people using this medication do not experience serious side effects. However, it is important to inform your doctor if you experience any serious side effects such as stretch marks, skin thinning or discoloration, acne, or small red bumps on the skin. In rare cases, the medication may be absorbed into the bloodstream, potentially leading to side effects of excessive corticosteroid exposure. These side effects are more likely in children and individuals using the medication for a prolonged period or over large areas of the skin. Contact your doctor if you experience unusual tiredness, weight loss, headache, swelling of the ankles or feet, increased thirst or urination, or vision problems. While a serious allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of potential side effects. If you notice any other effects, contact your doctor or pharmacist for further guidance. Before using mometasone, it's important to talk to your doctor or pharmacist about any allergies you may have. This product may contain ingredients that could cause allergic reactions or other issues, so it's best to discuss it with your pharmacist. Make sure to also share your medical history with your doctor or pharmacist before using this medication, especially if you have poor blood circulation, diabetes, or immune system problems. Corticosteroids can potentially make skin infections worse, so if you have a skin infection, it's important to inform your doctor so it can be treated properly. If your condition doesn't improve or if you notice worsening skin symptoms, be sure to let your doctor know. Using corticosteroid medications for a long time or over large areas of skin can make it more difficult for your body to respond to physical stress. Before undergoing surgery or emergency treatment, or if you experience a serious illness or injury, inform your doctor or dentist that you are using this medication or have used it in the past few months. If you're planning to have surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. There is a possibility that this medication may temporarily slow down a child's growth if used for a long time, so it's important to have regular checkups with the doctor to monitor your child's height. During pregnancy, it's important to use this medication only when clearly needed and discuss the risks and benefits with your doctor. It's not known if this medication passes into breast milk, so it's best to consult your doctor before breastfeeding. When using Mometacure 0.1% to 5% topical creams kit corticosteroids, it's important to be aware of potential drug interactions. It's possible that other medications or products could affect how Mometacure works, or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as any herbal products, and make sure to share this list with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. In terms of optimal timing, the recommended daily dosage of Mometacure 0.1% to 5% topical creams kit corticosteroids should be followed as directed by your doctor. This medication is typically applied to the affected area once or twice daily, or as prescribed. It's important to follow your doctor's instructions carefully and not exceed the recommended dosage. Remember, consistency is key when using Mometacure to ensure maximum benefits. If this medication is swallowed, it can be harmful and may cause serious symptoms such as passing out or trouble breathing. In case of an overdose, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. Residents in the U.S. can call their local poison control center at 1-800-222-1222, while residents in Canada can call a provincial poison control center. Always keep this medication out of reach of children and pets to prevent accidental ingestion. Remember, this medication is prescribed for your specific condition and should not be shared with others. Do not use it for other skin problems unless instructed by your doctor. Your doctor may need to do some tests while you are using this medication, especially if you use it for a long time or over large areas of the body. Make sure to keep all your medical appointments and consult your doctor for more information. If you forget to use a dose, use it as soon as you remember. If it is almost time for the next dose, skip the missed dose and continue with your regular dosing schedule. Do not apply extra cream to make up for the missed dose. Be sure to store this medication at room temperature and keep it out of reach of children and pets. Do not dispose of the medication by flushing it down the toilet or pouring it into a drain unless specifically directed to do so. When the product is expired or no longer needed, be sure to properly discard it. If you have any questions about how to dispose of the medication, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.